This is Sara and I'm Policy and Communications Manager at Friends, Families and Travellers. Friends, Families and Travellers is a national charity working on behalf of Gypsy, Roma and Traveller communities. And today's online event we're co-hosting with Public Health England. Louise, would you like to just do a quick introduction there?
Hi everyone, my name is Louise and I'm one of the nursing team at the National Immunisation Programme at Public Health England. Really excited to be here and looking forward to this fantastic meeting.
Thanks very much, Louise. So just to get kicked off with a bit of housewarming really, so just as I've said, as people have been joining, if you can please keep yourself on mute during the kind of main plenary session. Later in the call, we will be breaking out into breakout sessions. And at that point during the call, there'll be plenty of time and space as well to have conversations. But when you're in the main call, we'd really ask if you keep yourself on mute. The button for turning your mute button on or off is in the bottom left-hand corner of the screen, and it looks like a microphone. If you feel comfortable with it, then we really ask if you could turn your video on. We'd love to see as many faces as possible. And the button for turning your video on or off is in the bottom left-hand corner of the screen, and it looks like a camera. Please do, and I can see people are doing this already, please do introduce yourself in the chat and feel free to ask any questions or make any comments there. We will be having a Q&A section as part of the webinar, so the chat section will be monitored by my colleague Lucy, and questions that are posed there will be put forward for the Q&A session as well. You can access the chat by clicking on the message icon on the bottom middle of the screen. We are recording this meeting. So if we're recording the meeting, so please let us know if you've got any issues or concerns with us sharing it. If we don't hear from anyone in the next 24 hours, if that is the case, then we are planning to share the recording publicly. But if in the meantime, if anyone does get in touch and say, I don't want my name or my face to be as part of that recording, we'll of course honour that wish, so we will. So do please message myself or Billy, who sent out the invitations, if that is the case for anyone. And then just as part of the housekeeping then, really, we want this meeting to be a positive space with open discussion. So anyone who is deliberately disruptive to the meeting or being rude to other participants will be removed from the meeting with no warning as well. We just ask as well that within the meeting that you keep the language as accessible as possible. And then just as I'm looking through the agenda here, we have the plans for the meeting is we've got 2.5 hours with a comfort break in the middle. The first half of the session is going to be focused on hearing from people who are involved with good practice across the country. And the second half of the meeting will be around breakout sessions and having conversations there. So just as a bit of background and context, there are between 300,000 and 500,000 Gypsy, Roma and Traveller people in the UK, and there's a huge diversity of communities who fit under the Gypsy, Roma and Traveller umbrella term. This includes Romani Gypsies, Irish Travellers, migrant Roma communities from many different countries, Scottish Gypsy Travellers, Welsh Gypsy Travellers, New Travellers, Boaters, and many more. Each of these communities have their own distinct histories, in many cases cultures, and in many cases languages. We really could cover this in a 2.5-hour webinar all by itself. If you're still learning about the differences and distinctions between various communities, I'll post a link in the chat in a moment, which might help with this. Of course, people from Gypsy, Roma, Traveller communities don't all hold the same views on things. So let's not fall into the trap today of assuming that everyone is the same while we're talking about immunisations and vaccinations broadly for a wide group of people. Broadly, existing studies indicate that there is low uptake of vaccinations in Gypsy, Roma and Traveller communities, and evidence shows that when vaccines haven't been accessed historically, this has primarily been for structural reasons rather than for cultural issues, and that's often where we see the focus being placed. We had planned this event in pre-COVID times to bring this issue into focus, but of course, as the various COVID vaccines are being rolled out, this brings the issue into a more stark and urgent focus. We know that existing health inequalities place more people at risk of poor outcomes for coronavirus in Gypsy, Roma and Traveller communities. In recent weeks, the University of Manchester released a study which showed that the average health of a 6-year-old from a Gypsy or Irish Traveller community was similar to the average health of an 80-year-old from the white British population of England. However, we also know that there be high levels of poverty, employment insecurity and inequalities relating to accommodation, which may place Gypsy, Roma and Traveller people at higher risk of spread of COVID in GRT communities. We are worried that existing inequalities and uptake of vaccinations will be repeated throughout coronavirus. And of course, we've all seen concerns in the wider public about the new COVID jab. A poll commissioned in December by the Royal Society of Public Health showed that only 57% of respondents from Black, Asian and minority ethnic communities were likely to accept a COVID-19 vaccine, compared to 79% of white respondents. And I know that some of our speakers today will share information on what they're hearing on the ground about the COVID vaccine. Today, you will hear about some of the practical challenges of ensuring access to vaccinations for Gypsy, Roma and Traveller people, not least of which access to primary care and accessible communication play a huge part. You will also hear of lots of local initiatives where trusted individuals and organisations are working successfully to ensure that Gypsy, Roma and Traveller people are able to access vaccinations and have the information they need to make their own choices about their health. Over recent months, we have heard anxieties from people from Gypsy, Roma and Traveller communities of being targeted or forced to have the COVID vaccine. And we really want to stress the point that in our work of addressing inequalities and access to vaccinations, that we don't unwittingly terrify people by being too forceful or thinking we're better placed to make decisions than they are about their own lives. So please just keep in mind during the session our two aims: improving access to the vaccine and ensuring everyone has the information they need to make decisions about their own health. And I think just as a last thing from me, our ability to take part in organising this webinar with Public Health England has been as part of the VCSE Health and Wellbeing Alliance. We are funded partners of the Department for Health and Social Care, NHS England and Public Health England. So we'd like to thank them for that funding, which has enabled us on today's event. I'm just going to pass over to you, Louise.
Thank you very much, Sarah. Can you hear me okay? Brilliant. As Sarah has already mentioned, we have been planning this event for a while. We had initially hoped that it would be a face-to-face meeting, but COVID had other plans. So we're very excited that we've been able to organise it given the current situation. And I just wanted to say before we start that the evidence is clear that immunisation protects against infectious disease and saves lives. This past year has shown us a lot of things, but particularly how devastating an infectious disease can be when there's no vaccination available. Everyone in the PHE immunisation department is passionate about vaccination, and we're really committed to making our programme as inclusive as possible. So we're very excited to be here today as part of this meeting and to help us find out how we can improve access to immunisation for Gypsy, Roma and Traveller communities. We have a very packed agenda today, and so I don't want to spend any more time talking. So I'm going to pass over to Gaba, who's our first speaker today. Gaba Smolinska-Pofley is Deputy Manager and Roma Support and Engagement Programme Leader at the Roma Support Group. And she's going to talk about a spotlight on good practice on how to improve uptake. Thank you, Gaba.
Thank you. So just quickly to say that in the past I have delivered our Roma's health and mental health advocacy projects. More recently, it's another colleague who delivers those projects. But for years, I have been sort of working with Roma community members and supporting them in accessing health services, raising their awareness of how to access services, general awareness of health-related issues, and so on. And in the process, we have supported people in accessing GP practices and helping people to sort of understand the, generally speaking, vaccination programs in the UK, and sort of making them aware of, you know, how to access, you know, why it's sort of good to access vaccination programs and so on. In our experience, we've noticed that many Roma community members were worried to begin with. Many of those we supported were worried to access vaccination programs because often they didn't know, didn't have a records to begin with when they accessed their GP practices. Sometimes they were prevented from registering because they were asked to provide their vaccination records for children, which they sort of left behind before they traveled to the UK. So we had to support them in registering with GP practices in the first place. And then once sort of they were registered, they often sort of were worried that if children are vaccinated, you know, like for the second time, they may sort of become ill, it may have a negative impact. So we had to work with health professionals and their families to reassure them and make sure that they feel sort of safe, and they feel that children are safe and can safely be vaccinated. In the process of working with the community members, we worked with many health professionals, and we work across London, and like more recently we actually work across the UK, because providing now online services, we often have now committee members outreaching us from all sorts of places in the country. So in the process, we supported sort of Roma community members in Redbridge, and we work closely with many professionals in Redbridge, including the health visiting team in Redbridge. And I'm just going very quickly to tell you about like excellent example of good practice, because what we see often when we are outreached by professionals, like kind of people ask us how to sort of communicate with community members, how to provide information. We are preparing some leaflets, and you know, could you distribute, and so on. What we realize over the years that the best way to engage with communities, to outreach them, to go into the community, speak to community members directly, ideally have Roma bilingual advocates who will be able to explain things in the community languages, will be explained to understand what fears people may have, use the accessible language which people can understand. With Redbridge, what they noticed is that they have a large Roma population. They knew that from the school sort of records, from the communication with schools. However, not so many people access their health visiting services. So they were able to sort of get a little bit of funding, pot of funding to outreach, to carry out the outreach work with community members. They literally went out, spoke to moms in front of the school gates, and introduced the services instead of like kind of leaving the leaflets which people may not be able to read. Many community members we are working with have literacy problems and may not be able to read like complicated leaflets. And the word of mouth is the best way to communicate and pass the information anyhow. So the outreach workers could speak community languages, and they talked to moms, they sort of introduced the services, and then they were allowed to hold the sort of surgeries in people's homes. So they gained trust of few individuals at first. Those invited them to their homes, and then invited all the community members. And slowly, like kind of gained trust of a larger number of community sort of representatives, of moms who were like looking after local children in that particular area of Redbridge. As a result, just to cut it short, as a result, they had an increased uptake of health visiting services, and because they were allowed to carry out immunization in people's homes, they have a huge, incredible increase in uptake of vaccination and early childhood vaccination. Without that outreach program, people just would not access services. So we have like numerous examples of similar sort of projects where different services, not only health services, outreach people, and through outreach and then communicating through bilingual Roma advocates, communicating with people directly, explaining the sort of whatever health sort of issue they want to promote, raising the awareness and making it accessible to people. You know, good results can be achieved. Sometimes just small changes in the service can achieve really good results. With that program, they had something like, you know, from like extremely small number, majority of people sort of who they knew through school records were uptaking the sort of health visiting services and participating in the early immunization program. More recently, very recently, in fact, like a few weeks ago, my colleague who is at the moment coordinating our mental health advocacy project, and more recently under the pandemic, we extended to general health, and organized peer support group around the COVID vaccination, just to see, you know, like kind of what information people may sort of need, what information people have, you know, their views on the immunization. And we also had the NHS worker who was able to provide information about the vaccination itself. So what we found through that meeting, that people have mixed views and mixed feelings about it. there's a sort of proportionally what we would say, we have a half of the participants who really wanted and like to be vaccinated, and they are really worried about the COVID. Obviously, what we see generally speaking, like that many of our service users have been affected by the pandemic. We have many service users who have been very ill and many who have died. And people are generally speaking very worried. So we had about half of the participants who really wanted to be vaccinated, and they wanted to know, how they can access the vaccination program. But we also had a second half of people who are extremely worried. So what we all see is there's lots of information on the social media, on the internet, and some of this information is sort of suggesting that the vaccination, COVID vaccination, may not be safe to people and may have sort of adverse effect on people. So we had numerous people who are very afraid of COVID, who are deeply, aware of, it can affect them badly, but at the same time they are really worried about being vaccinated. And we feel we need to work closely with both NHS and our community members to inform them, provide as much information so they can sort of make an informed decision. So I think that's just what I wanted to say. Obviously I could speak much longer, but we have limited time. So thank you for listening. I think my time is more or less coming up, and unfortunately I can't stay for the question and answer session, but if anybody wanted to contact me sort of later on after that meeting, I'm very happy for Sara and her colleagues to provide my contact details. Thank you.
Thank you so much, Gava. That's really helpful and such a useful opening to the call. We really appreciate that. Next, I'll be passing over to my colleagues, Michelle Gavin and Emma Bray from Friends, Families and Travellers.
Okay, hi everybody. I'll just get my sharing screen up. There we go. Let's get it up there. There we are. So yeah, I'm Michelle Gavin and I'm a projects manager for Friends, Families and Travellers. And basically I support the outreach team. We have quite a large outreach team and we cover West Sussex, East Sussex and Brighton and Hove. And I'm going to just introduce my colleague, Emma Bray, as well. Emma.
Hi. Hi, I'm Emma Bray. Can you hear me?
Yes.
Yes, sorry. Hi, I'm Emma Bray. I'm an outreach worker. I'm also a traveller and a mother to 3 children.
Okay, lovely. Thanks, Emma. So we're going to look about community-led approaches to health improvement for the Gypsy and traveller communities. And as most of you will probably know, the issues around health, Gypsy and traveller communities are known to face some of the worst and most severe health inequalities and poor life outcomes amongst the United Kingdom population, even when compared with other ethnic minority groups. But today we're particularly focusing on immunisation programmes, and I want to start with what some of the main barriers are to immunisations. And as Sarah said earlier, a lot of it is structural. However, many Gypsies and travellers feel that those mainstream services are not for them and are reluctant to actually access them, mainly because of fear of prejudice and possibly discrimination. There's also a lot of hesitancy due to word of mouth and some misinformation, and this could be passed down generationally. If you're very highly mobile nomad, you will be unlikely to be talking to others outside of your immediate community, and some of these pieces of misinformation or reluctance have been passed down generationally. So and it can also be down to a bad past or historical experience, and that could be just by accessing a GP. If you've had a historically poor experience or something has happened related to your healthcare, then you're unlikely to want to go and have something when you are well. As I said before, there's some it's a very wide-ranging reason why many people will have reluctance to be immunised. One of them for some communities, particularly the Irish traveller community, is there is a religious implication, and this has been handed down probably since the 60s and 70s actually, on ethics relating to one particular vaccine being used from an unborn fetus. And one of the ways that in the past that I've used to try to talk that through, people often say to me, it's going against God, you know, that's why we won't have the vaccine. It's going against God, but not kind of understanding why it's going against God, because somewhere along the line of the different generations, those reasons have been forgotten. It might have come from grandma, and now it's with somebody and they're not quite sure why it goes against God, but that's the reason. And some of the really important things that have happened recently, particularly with the new Pope that's around us, he's been very supportive of immunisation programs. He's seen in South America giving the injections to young children in poor areas. He's South American himself, and recently he's also had the COVID jab. So there are ways that you can talk about situations like that. There's a lack of clear information, and people maybe not getting the information in the way that is pertinent to them. So that can be a big barrier too. And one thing that comes up an awful lot when I talk to people who haven't vaccinated their children is the perceived link to autism. And that's something that obviously came up back in the 1980s, 90s, when Dr. Wakefield, who's now since been struck off, managed to get into the press that he was fearful that the triple MMR jab was linked to children being born autistic. And of course, we know that this was completely discredited. However, some of those images and voices from that time still remain on different forms of media, and it's been passed down. And I myself, I was married to an Irish traveller. My children, neither of them had the MMR jab at the time, because I wasn't working in healthcare. I didn't really understand why at the time, but so neither of them had it. And it resulted in my daughter only a few years ago actually contracting measles in a Surrey outbreak. And she was very, very ill with it. And the first thing she said to me when she recovered was, for goodness sake, make sure you tell everybody to get the measles vaccination at the MMR jab for their own children. So, you know, it can happen to the best of us, or if you like to look at it like that. And I know at the time as well, the Prime Minister at the time was and he wouldn't come out on record to say that he'd given his newborn son or his young son Leo the vaccination, and that, you know, and of course, you know, that herd immunity dropped at that point. So I think you've also got to look at the highly mobile nomadism of some groups within the communities, and the lack of being able to access appointments, or the perceived lack. And one of the things that some travellers are very keen to keep going are the little red books that they get when the child is born, so they can have the updates. So that's something that maybe health visitors could promote with the programme. And another thing, probably on top of everything else, is a lack of educational programmes which are targeted specifically for the communities. And we'll come on to that a bit later. I'm just going to pass now over to Emma.
Hi. So I'm going to talk a bit about mixed attitudes, possibly from my personal experience, but also I'm an outreach worker for FFT and have been for 10 years. You do get a very mixed attitude to immunisations, and some of them, touching on what Michelle said about fear of, you know, links with autism. We're talking about a community that has really high infant death, so it's a very real fear for them to have something damaging to their children. They also have what I would call like a hierarchy. So if there is an older person in that community that they very much will respect, that opinion can quite often affect the whole of the site. So it can affect 10 or 15 different families' opinion on immunisations. So I think that we need to go for a real community approach rather than what I've had, which is a kind of a one-on-one targeted approach for a mother who's had a child. We need to look at actually changing the community opinions. We have had some mothers who have really advocated for immunisations. They normally are mothers that have had premature babies and have been in with the nurses for a long period of time and had that one-on-one education directly from the nurse in the intensive care, and they've explained to them and been really kind of gentle in their explanations why this is so important. They've then gone out into their community and actually cascaded that onto them, which is brilliant. And I think that just shows that what we need to do is we need to kind of focus on educating people. You know, they've got a real lack of kind of access to healthcare. They've got no interest for people like commissioners or doctors because they don't have any interest in them. They've already kind of have a mistrust for these people. So I think we need to look at talking to people like commissioners and stuff and actually say, look, you need to take an interest in this community if you want them to take an interest in you. Flexible appointments and reminder texts is a brilliant idea. We do this as an outreach team with our clients. So I will actually put in my diary, and the outreach team will, when their appointments are, and actually constantly remind them. Now this would be great if we didn't have to do it and it could come directly from, I know some GPs do various things, but actually it could be a national thing. It would be brilliant. Health Champions program, I'm part of this program, and it's absolutely invaluable for me. It has been a kind of a real learning experience, and this is what you've got to think. If, you know, me at 30 years old with 3 children, I was highly mobile all my life. What's that, 2 minutes? Highly mobile. So I never had any interaction or immunisations at all. My mum just didn't have anywhere to go and access those. So we're now talking about kind of another generation with my kids. Well, I'm educated enough to explain to them why they should do it, what the reasons are. But we've still got people of my age group and younger that have no access to these information. All they have is Facebook. And that is a real, you know, something that you use day to day for their health information. Quickly, let's just talk about, if we've got a minute left, building trust. It really needs to come from, you know, building trust is one thing. It needs to come from doctors and nurses. They need to have cultural awareness training. We need to look at targeted outreach work, and people that are doing outreach work already in these areas need to have cultural awareness training. There's no other way of doing it, in my opinion, unless it comes from the health professionals themselves taking a lead on it. It's very difficult to get a whole community on board. We definitely get individuals on board. We do that every day, but definitely need to look from a top-down approach, I believe, from commissioners.
Okay, I just want to make just a quick, I know we're running out of time, so a spotlight on what we do at FFT. We create health champions through we adapt training modules created by the Royal Society of Public Health, and we translate them into material which is accessible for people with low literacy, and we use all the resources that that resonate with the communities, basically. So our program, we talk to people, we find people from the community, we bring them in, we do the workshops with them, they sit the exam, and then they become a health champion. They can cascade the pertinent information. And one of the modules on the level 1 is we cover vaccinations in quite a depth. We've developed and designed a board game called Anti-Vaxxers Vardo, which is a journey on a Vardo. As you can see, it's being played out here, where you land on health cards, you have squares which you've landed you in ancient Samaria, and you might have polio, but unless you've got the vaccine card, you have to do what it says on the card, which might be takes 2 steps back. And the idea is to go around the board, someone's a health champion, and they will actually speak and tell you what each disease is, etc., etc. Sadly, we had 100 graduates. I'm just going to finish really quickly from our Health Champions program. This is a glimpse of them. We had a ceremony, I think it's 2019-20 now, and this is where people could really celebrate what they did. So we've put over 100 people through this program now, and it's really successful because people know how to manage their own health, and if they're given the right information, they can cascade that in a pertinent way throughout their own communities. So
thank you, Michelle and Emma, for those really helpful insights. That was really interesting. I'd love to play Anti-Vaxxers Vardo at some point, so thank you very much. I'm now going to introduce my colleague Sadie, and Sadie works at the London School of Hygiene and Tropical Medicine, and she's going to tell us about her experiences working with the Romanian and Roma Romanian communities during measles outbreaks. Over to you, Sadie. Thank you.
Thank you. Good afternoon, everyone. Thanks for the opportunity to talk at this event. So as Louisa said, I'm a researcher at LSHTM, and today I'll be presenting some key findings from a study conducted with colleagues at LSHTM and Public Health England. And this study explored factors influencing vaccination amongst Romanian and Roma Romanian communities in 3 English cities, Birmingham, Leeds and Liverpool. And these cities were affected by measles outbreaks in 2017 and 2018. This research was funded and conducted as part of the NIHR Health Protection Research Unit in Immunisation. Apologies, just having a problem moving my slide. In fact, there we are, wonderful. Sorry. So firstly, I'll provide a brief background to the study and why it was conducted. So in England between 2017 and 2018, there was more than a 3-fold increase in confirmed measles cases. So from 259 cases in 2017 to 960 cases in 2018. And several of the measles outbreaks during this time particularly affected Romanian and Roma-Romanian communities, including outbreaks in Birmingham, Leeds and Liverpool. So our study really aimed to look at any factors influencing vaccination amongst the communities. We conducted qualitative interviews across Birmingham, Leeds and Liverpool with 33 key providers, so people essentially involved in delivering vaccinations and managing the outbreak response. So this included frontline vaccinators and also representatives from Public Health England, the health protection teams, screening and immunisation teams and local authorities. And to also try and gain insight directly from community members, we also interviewed 9 Romanian women in one of the cities, and 3 of these women also identified as Roma. And with these interviews with the Romanian community members, we wanted to explore more their vaccination views and behaviours. So now to talk about some of the key interview findings. So firstly, to look at some of the vaccination behaviours and beliefs reported by the community members. So amongst the interviewed community members, most considered vaccinations beneficial.
Sadie, something seems to have muted you there. I'm sorry. I'm asking you to unmute. There seems to be some sort of technical glitch, but it should be fine now.
Apologies. I don't know what happened there.
Okay,
sorry. I don't know where I cut off. Apologies. I'll just catch up from there. So although, yeah, I was saying, sorry, that most of the community members felt that vaccinations were important and beneficial, but there were a minority of community members that hadn't fully vaccinated their children, as they believed that vaccines cause more harm than good and produce damaging side effects. And there were also some beliefs that vaccines may not be effective, as this first quotation on the slide shows. Providers, particularly in Birmingham, reported that measles was not necessarily a disease that caused concern amongst the communities. Several providers felt that community members considered contracting measles more as a kind of rite of passage, and it was considered beneficial to contract measles rather than vaccinate, so as to develop a kind of natural immunity to the disease. So this quotation exemplifies this. In one family, we had 8 members catch the virus, and they'll say, well, it's better to catch the natural infection than to have the injection. I just think they think measles, it's a bit of a rash and that's it. Providers considered access to primary healthcare to be a major barrier to vaccine uptake, and this was in all 3 cities. Providers reported that registration with general practice and lower primary care use were an issue amongst the communities, and there are several reasons reported for this. This included uncertainty around entitlement to care and also challenges in navigating the system, so understanding even how to register at the general practice, particularly in the presence of language barriers. And unfortunately, experiences of discrimination were not uncommon, as highlighted by this quotation. So to get to the GP, you have to get past the front desk, and it's the front desk that we're finding are really resistant to registering patients. Some of the receptionists are out and out rude to the new arrivals, particularly if they're from Eastern Europe. Community members reported language and literacy as major barriers to accessing credible vaccine information and also giving informed consent for vaccination. As highlighted from this quote, it would be very helpful to have both leaflets, so written information, and some advice in person, so verbal information. With the leaflets, very hard because of a lot of Romanians don't go to school and can't read really well, so it's better or more helpful if someone can explain to them in person, face to face. Providers also discussed issues around communication barriers, and providers often struggled to distinguish the difference between Roma and Romanian, and particularly when it came to language. So many Roma speak Romani as a first language, and the language of their nationality may be their second language, but access to a professional Romani speaking interpreter was discussed as not possible. So even when providers were aware that Romanian was not the preferred language, they kind of remained reliant on accessing Romanian interpreters due to a lack of professional Romani interpreters. And I understood from some of the interviews as well that the use of Romanian interpreters could be problematic given the potential history between the 2 groups and discrimination of Roma in Romania. Past experiences of vaccinations in healthcare in Romania and the UK affected the decision to access vaccines and health services amongst some of the community members. So understandably, negative experience could create a distrust and fear of vaccines and health services. And I think this for me really highlights the importance of understanding the context of people's lives and how this might shape their decision making. So here we have a quotation from a community member who's saying, "I was afraid to have the vaccination for my child, for my boy. I was afraid because in Romania a lot has happened. I got scared and I refused. Why did I refuse? Because someone in our village died because of the vaccine. The vaccine wasn't done properly. I was afraid to have the vaccine on him and I refused the vaccine." So although from this quote it isn't exactly clear what happened to the child, the reporting of his death around the time of vaccination obviously generated some fear in the community. And in this instance, the community member had become more distrustful of doctors and subsequently concerned about vaccinations. And this community member talked about numerous experiences of negative kind of healthcare experiences in Romania in relation to herself and family members. But I thought what was really interesting about this interview was that this lady actually talked about when she'd been in the UK, she'd had more positive experiences of healthcare and she'd actually started to change her view on vaccinations. So it was really highlighted that the importance of discussion between community members and providers to kind of build up trust in accessing healthcare and trust in accessing vaccinations. I think it's important to mention as well that in the context of other competing demands, vaccination was often not one of the main priorities for community members. So the communities were described as having a more reactive response, living day by day and dealing with kind of immediate stresses, which included financial instabilities. So here we have a quotation: "In the great scheme of things, vaccination tends to be a little bit lower down the list when you struggle even to wonder what you're going to feed your children or how you're going to live for the rest of the day." So given this kind of context, providers discussed that setting up kind of booking vaccination appointments in advance wasn't necessarily a very effective approach either to try and improve vaccination, and instead indicated the benefits more of using actually different approaches like drop-in clinics for vaccinations or more outreach approaches, so trying to go into the communities and offer vaccinations in that setting. I now just want to bring this presentation to more of a close by discussing one of the most effective ways of engaging with communities that I found that were reported as part of the study. So providers discuss the outreach approaches, so door-to-door knocking or using mobile vans and offering vaccinations into community centres were really effective in increasing uptake. And really what was key to the effectiveness of any of these strategies was being able to take advantage of pre-existing links with communities and establish trust. So that really had to be there as a core component to be able to make this work effectively. And this is just an example from one of the cities where they actually held a vaccination centre within a vaccination session within a children's centre. And the Children's Centre was really well known to community members. So as we can see here, they trust the Children's Centre. It was somewhere they go to when they need help. So I think that made a difference. The Children's Centre is very much part of the community, not the establishment. So they achieved really good uptake here. And they offered a meal as well at the time of coming for the vaccination. And I believe that the GP practice was also very close to the Children's Centre. So actually, once they'd had some more conversation with community members, you know, they were able to encourage them also to go and register at the general practice. So I'll just move on to some of the key messages from the presentation. So factors related to access in particular were the main barriers to vaccination. There are also issues around acceptance, but much more strongly that came across was barriers related to access. The development of trust from face-to-face contact between communities and providers is key to promoting vaccination and really to reducing inequalities in health service access much more broadly. And just to stress the need for more proactive and consistent approaches to engaging with communities. Thank you very much for listening. I'd like to thank all the participants firstly for their time and contribution, and acknowledge the following people, particularly Sandra Mornier-Jack at the London School of Hygiene and Tropical Medicine. I've included some links there as well to publications, but I can share the slides as well.
That is wonderful. Thank you so much, Sadie. That's really, really brilliant and really helpful. I can see that some questions are starting to come in through the chat, and just to remind everyone that after the next kind of mini talk, then we'll have the Q&A session. section of this online event. So if you do have questions, pop them into the chat, and my colleague Lucy is just monitoring the chat, and we'll read those out in the kind of Q&A section as well. So last but certainly not least, I'd like to hand over to Liz Keat, who's an outreach nurse at Leeds Community Healthcare, and Charlotte James, who's Community Health Coordinator at Leeds Gate.
Hi, thank you very much. Thanks for having us. Charlotte, do you want to share the presentation, or shall I?
Do you want to do it, seeing as you had a practice?
Okay. Seamless, there you go. I'm just gonna, we've not got Cindy Lou unfortunately because she's poorly today, but I'm just gonna hand straight over to Charlotte.
So, hi everybody, thanks for listening. I am Community Health Coordinator and also a community member at Leeds Gate. I think I'm just going to probably be building on what a lot of people's already said around some of the barriers that the members in the community are facing with the vaccine, and like what's already been said, a lot of these are low literacy, lack of understanding, due to a lot of members and community members being like marginalised, out of education, and we've seen that our roadside families are even more vulnerable, and also more isolated and excluded from mainstream due to having not a permanent address, which we've been doing a lot more work around this with the members, making it more easy for them to access doctors, so offer them support with sorry, I'm a bit tongue struck there. So offering them support with accessing doctors. Liz has been supporting us with that, and we've been taking a very asset approach also, where we've been listening to members. We've had a lot of good outcomes from this in the past, so we feel like it's something that Leeds Gate are very passionate about doing, and obviously in line with Leeds Gate values is to making sure that we're listening to members and what they want, and making them understand what approaches we've got going forward for them to understand what the vaccine is, giving them a better chance to make that decision if they're going to have it or not. Obviously, we've spoke a lot about the barriers that members might be facing, and I think we've all got quite a good understanding of that, and this is obviously due to lack of education. I think it's also highlighted throughout the lockdown. Some of the barriers are due to members being excluded from having access to Wi-Fi. This could be various reasons. A lot of it is due to the location of sites. We've been doing a lot of work around that, and I think due to the lockdown, it's really enlightened that. So that's a really good, thing that we're really pushing through with trying to get members and the community more included into things, because obviously having access to the internet is including you in what's present at the minute, giving you information, up-to-date, accurate information. If somebody wants to research, they're able to, but if they're excluded, then we've found that this is something that's really present within the community. So like I say, we've really established what the barriers are, but at Leeds Gate we've been really trying to work with community members to gain their trust, and to do that is an asset based approach, was really getting members involved. And we did a questionnaire research of 100 members to identify what their worries were around the vaccine. And I think, do you want to put the slide up with some of what the community was saying, Liz? So we had a broad feedback from the questions, which we're now working with rural media to make a video answering the questions from the community, and and we've worked with rural media before and had a really good outcome. We're going to be using members' voices so that it's really familiar to members, that they identify some of the voices within the video, which we're hoping will make it easier for them to understand. We're also going to be using some of our partners who our members are familiar with in the videos, which we hope obviously that will help them to understand the video, answering all questions around the vaccine, just to give the members a better chance of making the right decision to whether or not they want the vaccine or not. At Leedsgate, we've just found it really important to be able to share the right accurate information and make it as though people can listen to it and understand it, hoping that they make the right decision to either get it or not. I think we've only got a couple of minutes, so I'll pass it on to Liz if you want to add anything.
Thanks, Charlotte. So that was, I think you saw in the background some of the research that Leedsgate have just done, and that's not all compiled yet. That was just sort of early findings. But I suppose a lot of our success is working together, really, you know, working in that outreach model and really listening to the community. And we're all employed due to needs, aren't we? And we forget that actually it's a huge amount of assets in the community. It's a community where, you know, people are important, families are important, children are important, you know, elderly and ill people are protected. And actually this word of mouth approach often works better, which we've found with other things that we've done within the community. And I suppose a lot of my interest is in systems. So we're aware of that. You know, the uptake might be lower, but we really need to look at what the access is like for the people who want it. And I'm always saying to nurses, and I am a nurse, but you know, we need to stop going in trying to save people and save communities because they don't need it. That's not what our job is. And even though it's our sort of, it can often be our approach. What we need to really look at is to look at making our systems a little bit less rubbish. So it's trying to remind our whoever commissions us and all our statutory services of their responsibilities. So if children are electively home educated, whose responsibility is it to offer them the vaccine? Because it is a grey area and they get lost to follow up, and then it just becomes that, oh, they've not engaged with it. But how have you tried to engage them with it? You know, have they received the invite? Have they read it? Have they understood it? And also, you know, I suppose little things like thank you, Sarah. I'm a quick, not Yorkshire speaking, talking person. Within Leeds, we've looked at things like whose responsibility is it to visit children that live on the roadside, and actually it was nobody's in terms of health visiting, because all the health visiting referrals come in through, you know, you register with a GP and then that comes through. So we've got this whole cohort of children that weren't receiving a health visiting offer. So therefore, you know, whose responsibility is it to look at whether or not those parents want immunisations for those children? So we need to look at the systems change, and because we're really good at thinking, oh, let's send a van in to go around and vaccinate people, which may be a really good approach, but actually what it does is all those other services whose job it is, that they can just take their eye off the ball really and not really consider their population groups in their services. So it was I would always think we needed to start there. That's me done, Sarah. Thank you.
Thank you so much, Liz and Charlotte. That is really, really helpful. I love that image in the last screen. It really says it all, doesn't it? Fantastic. It's been so interesting to hear the contributions of all the speakers so far. A lot of food for thought there, and a lot of really common themes there around trust and around access. And it really is coming back to some of the basics and things as well. These aren't new problems, they're just presenting themselves in new ways through the same system. And if we don't start to work in different ways, we're going to have the same problem in 10 years' time, in 20 years' time. Now I can see that there's been lots of questions in the chat. I know my colleague Lucy, in between letting people in and muting people to come off mute and things, has been monitoring the chat. Lucy, do you have a few questions there that people have picked out that you'd like to put to the speakers?
Yeah, indeed. A few people have asked whether the slides will be available, and I think whether the recording of this will be available. So that's probably a question for you, and I think that's a yes.
Certainly if all the speakers are happy to share slides, we're happy to share them out with people, and we are planning to share the recording as well for people who were here today or who weren't able to attend. So unless we hear of anyone who has any reason why they wouldn't want to be, if their face is in the recording and this is not where they're meant to be in this moment in time or something like that, then we'll be sharing it out. Thanks for that, Lucy.
And in addition to that, Ian Wakefield asked a useful question. Could someone advise what is the best way to make initial contact with the communities, please?
Perhaps I could ask a speaker to come just off mute and answer that. Perhaps someone from Friends, Families and Travellers from Leadscape would be most appropriate.
Where's my hand?
Do you want me to speak, Sarah?
Yes, go for it, Michelle.
Okay, I think, you know, engaging with the communities, it's if you live in a locality where there may be a small grassroots group or a group nearby, like some of the smaller, there are smaller groups. If you go onto the FFT website, we have a list of people that you can check to see if there is someone in the area that will be able to have that trusted link with the communities already. Sometimes it will be, you'll have, if you're working in a GP practice, for example, you will have, you're likely to have Gypsy and Traveller people on your books, and it's kind of recognising that and maybe ensuring that you have culturally pertinent information and a welcoming, you might have the Travellers Times in there or something which recognises that you support Gypsies and Travellers and they're welcoming. There's quite a lot of different routes to try really, but initially I wouldn't go out on your own onto a site and, for example, if you've got a big site near you, and just sort of introduce yourself. I would imagine, like on the, if you've got, if there's a nurse or a health visitor that's working in the area that has got a good relationship with people on site, or there might be a specialist traveller midwife or something like that, that would be a good way to engage through a service that's already got a trusted bond with somebody. But if you go onto the FFT website and look at the service directory there, you'll get lots of very rich information, and there will be people that might be able to help you.
Thanks for that. I can see as well that there are quite a number of people from Gypsy, Roma, Traveller, border communities on the call. In the second half of the call, we'll have a chance for everyone to go into discussion there as well. So if there are people from Gypsy, Roma, Traveller, border communities within your groups, I'd ask that you really listen to those people as being the experts in their own experience and things. So hopefully in the breakout sessions, there'll really be a chance to have a discussion around that. Or certainly if you want some support and connections with linking them with charities in your area that are led particularly by Gypsy and Traveller people, feel free to give us a shout and we'll do our best to link you in. Liz and Charlotte, did you want to ship anything on that point at all?
I just agreed with what Michelle said, and I think it's you use trust as currency, don't you? You know, who's got trust with the community, and don't be too focused on what your way in is. I think, you know, when I first did my outreach job, there was an expectation that I would do a health check on 90% of the population, and actually nobody wanted a health check. So I think if you go in focused on what it is that you think you're going to do, but really open to sort of matching somebody else's agenda, really, you know, that's the only way to. But you know, if we take the health stuff out of it or wanting to help, it's just a relationship. You just go in as a human, trying to build a relationship up with people, with your human skills. And I would say that's where it comes down to, and work with trusted organisations. You know, do a lot of work with Leadsgate together. But quite often we did actually just you know, went on to roadside camps on my own and just said hello, and it was fine. And you know, just build that trust and relationship up slowly, but without too much of an agenda.
Yeah, I agree. I think, like Liz says, just work with people like, you know, as they're just like everybody else, and just obviously if it's something around health or something that's new, just talk to them like you would anybody else that you're telling about something new that they're unsure of. Obviously a lot of the trust issues are around uncertainty or lack of education, so giving somebody that insight into whatever it is and trying to educate them, you know, and then giving them the choice, you're not going to go wrong, I don't think, with that. So I think that's just like working with any other person. So yeah, that's sort of what I'd want to say.
I prefer it when I chip in as well. I prefer it when people come down and they don't have any type of uniform or even like lanyards and stuff. I know it sounds so odd, but really here in my site, it's like if you just come down and like the other women have said, you are yourself and you're quite personable, it's going to get you a lot better. If people come down and they're quite official in a uniform with lots of lanyards and clipboards and simple little things like that, it really sort of puts me off of interacting with them. I think it's important if you do have ID, and the nurses and stuff do, to have that with you, but definitely those kind of things with a community that don't really trust professionals in the same way that other people do. So like, for instance, some people might see that as a really respectable thing to wear uniforms and lots of things, but where I live, we definitely wouldn't appreciate someone coming down with a clipboard, full uniform and lanyards. It probably would be perceived in a negative way, whereas a lot of other communities might perceive that in a really positive way because it's a sign of, you know, that you're an official person. So definitely go for more of a personal approach.
Thanks so much for that, Emma. Betty, I can see you've got your hand up. I'm not sure if you want to make a comment or ask a question, but I'm sure either way you'll have something really useful to say, so please go ahead.
I can speak now, sorry.
Go for it, Betty.
Yeah, I did put in the comments to Ian, you know, most local authorities have equality and diversity officers, so that would be a good way in. And also here in the south, we've got Church of England chaplains, and the Churches Network are actually trying to train up new chaplains so that there'll be one in each area in the south, which is also a good way, because our chaplain, Reverend Jonathan, you know, he does make a lot of headway with the sites. You know, and as the other lady said, to go in with clipboards and lanyards and things and looking official is not the way to approach any site, whether it's council owned or private. So, but you know, there are lots of ways, and there are lots of us out there that can be approached. And as you say, FFT, you have got the directory, haven't you? I think Michelle said it. Yeah, you've got the directory. So yeah, there are lots of ways that that they can actually get into the travellers, and of course social media is the favourite. Thank you.
Thank you so much, Betty. That's really helpful. I think we have time for just one last quite fairly brief question to see if you've got one there.
Yeah, absolutely. This one kind of links in to the previous question, but is directed to Sadie. Someone asked with regards to Sadie's presentation, how did the community feel being targeted in that way for that research? So yeah, I'm not sure if that will provide some advice as well.
Yeah, no, I think that's a really good question, and obviously priority as a researcher is to, you know, ensure participants are happy with taking part in the study and to represent them properly. And you know, I think a challenge with this study as well was that it was obviously very reactive to a measles outbreak, and looking into the, you know, looking into ways of improving uptake. It was known that there was lower uptake amongst the Romanian and Roma communities, and it was known that there were measles cases emerging there. So it was also a priority to kind of gain some insight into what's going on and ways to improve access and make it easier for people to access vaccines if they want to. So I think, yeah, in terms of consent to take part in research, we always make people aware about exactly what the research is looking into, so they know exactly what's you know, what they're consenting for. And also, I'm always obviously very conscious of presenting people in the way that I would also want to be presented, you know, thinking about, I don't want to exacerbate any sort of stigma associated with the communities or anything like that. But I think it's also really important to understand if there are barriers to vaccination, what they are, so we can reduce some of these health inequalities and promote vaccination uptake in groups that have lower vaccination uptake.
Thank you very much for that, Sadie. I'm aware that it's now kind of time to take a comfort break before the second half of the session. I can see there's some hands up. If I can just take one last thing, Abilene, if you wanted to just make a quick comment, a quick question, and then we're going to go on a comfort break before we do the kind of workshop part of the session, where all of us will have a chance to speak to one another and feed back to the group. Abilene, did you have something quickly to say there? I think it has you on mute.
Is that Abu Bakr you're talking about, or Evelyn?
I've just asked Ablin, because I know she's done some work in Birmingham from her own experience. So Ablin, if you could jump in.
Can you hear me?
Yes, I can hear you. Thank you.
So sorry, I'm useless with Zoom. I'm not just saying that. I mean, I'm totally useless. Say was my work that I've done in the West Midlands. They were talking about Birmingham and the Roma community in Birmingham before. And my experience is that the Roma community, the Gypsy community and Traveller community in the West Midlands can't even get GPs. So we're all on to let's encourage people to take the vaccinations. Well, it'd be good if we could get them GPs. And another thing that I done in the West Midlands was take public health to a site, you know, to try and get rid of some of the myths and things. And when I took the 2 nurses to the site, they were genuinely scared before they went on that site. So, you know, even though everyone thinks that the problem's on our side on site, you understand, because we're scared of officials, whatever, a lot of the problem is on the official side, because the officials have heard that many myths about us that they struggle to go on the sites. And I think even get that barrier broken down with the public health, and even on the, you know, on the council sites, if we could break that barrier down and try and get that communication, I'm talking about all across Britain, if we could just move that forward a little bit, then that would be better for everyone. And another thing is that unauthorised encampments are still being moved on during a pandemic. What the government has said is to give them toilets and give them water, but it hasn't said not to move them on. And we're in the middle of a pandemic. So if everyone could speak to their councillors, MPs, whatever, and try and raise awareness of that. First, we need somewhere to stay. There's no sites. Then we need GPs before we even have all the other discussions. Sorry for getting myself, but I work with people that suffer.
No, I think that's really important. Thank you so much for that, Evelyn. And I know you've done some really important history shopping, particularly around Birmingham for that. That is really helpful. And I think it's just a note, just first to end the first half of the session rather. So just for the next 5 minutes, so just from now until 15:08, we're just going to take a little break. Turn off your camera if you want to, make yourself a coffee, have a glass of water, whatever you need to do. And we'll be back at 8 minutes past 3, so we will. Thanks, everyone. Okay, so I can just maybe introduce the second half of this session. I hope you find it really useful so far. For the second half of the session, really, this is hopefully going to be the part where you'll get to engage and speak to lots of other people and just kind of have the discussions about the first half of the session, and also just about really practical kind of challenges and barriers that you're seeing in your work at the moment. I'm aware this is a very live issue. And so our first breakout session, and it's noted on the agenda as well, is just what does good practice look like in improving uptake of immunisations within Gypsy, Roma and Traveller communities. So what's going to happen now is we're going to break everyone in the call into 10 breakout rooms. So shortly there should be a little kind of box will jump up on your screen, and I'll ask you to join a breakout room, and it should tell you the number of that. We're opening up 10 rooms, so we're looking to have about 14, 15 people per room. We'll have 20 minutes in the breakout rooms, and you'll have a chance basically just to discuss openly that kind of large question. So what does good practice look like in improving uptake of immunisations within Gypsy, Roma and Traveller communities? And what we're asking is that within every room, that one person within the room would just kind of volunteer to act as the kind of scribe or the person who's going to report back to the main room. So if in every room you're able to try to identify as a group what are the kind of 2 top things that you would recommend in terms of good practice and improving uptake and access of immunisations within Gypsy, Roma and Traveller communities. So please just remember which breakout room number you're allocated to, and please just make sure you kind of appoint that scribe. But other than that, what you do in the next 20 minutes is really up to you. Lucy is going to hopefully open up the rooms for us now. Bear with us, because tech can always be a bit of a pain, can't it? But fingers crossed, you'll get a kind of message on your screen in the next few minutes, so you should just click join when you get that message. Hi everyone. Hello all, welcome back to the main session. If you can just make sure you're on mute, so if you're not already on mute, then pop yourself on mute, otherwise we'll get lots of kind of horrible noises going back and forth. That would be fantastic. I hope you all enjoyed kind of the first kind of breakout session. It feels like there's so much expertise in the room and different types of expertise and things. So it's really good that there's been that kind of chance to share some of that as well. I'm sure you're all bursting with lots of ideas. What we're going to do now, there's 10 rooms and there was a room number allocated to each room. I've tried to note down a couple of people who are in each of the rooms just in case people haven't seen the room number. And then, as you know, I've asked just for a kind of reporter back from each room, just to give kind of the 2 top things that you want to tell other people on the call that they should be considering for good practice. Now, of course, you know, we don't have a great deal of time here, so we're going to ask everyone who's reporting back for a room to try to keep that to a minimum, a minute, absolute maximum. So really the kind of the headlines, the top points. So we're going to be making a bit of a note of these after the webinar, and we'll circulate them around as well. So if I can ask a person from the first room, room 1, this is the room that had Billy Doling from FFT in it, but it might be someone else who's the kind of reporter or scribe. If you wanted to come off mute if you were in that room. Now, it might be that the room numbers might have been too obvious. So I'm going to take a bit of a punt. Each room should have picked one person basically to report back. So if you were that one kind of special person in the room and you're feeling particularly brave, if you'd like to come off mute now, that would be fabulous. Or maybe if you could raise a hand even, I can call on you if that's helpful.
Can I go first then? Room number 8.
Room number 8, fabulous. You can go first, and then I can see Tanya Blumenfeld. I can ask you to go afterwards if that's okay. So okay. Go for it.
I'm Abu Bakr. Our team, we discussed lengthy discussion on trust-related issues, I think, and also we were a couple of our team members mentioned it's not just only the message we are talking about, trusted message. The messengers is so important as well. Who's taking that message to that community? So embedding that message into the trusted channels and have a clear communication and good communication and walking the walk with that community rather than just trying to involve with them just for abrupt relationship is not going to help. So we have to have a good trusted relationship and also trusted community leaders. That's important. That's what we have come up with. And also there were suggestions on cultural competency related awareness sessions for organizational members who's working with this community, like our part of our induction at work. So that might help to work with this community too.
Thank you so much. I really appreciate that. And thanks for being the brave one to go first. Next then over to Tanya Blumenfeld. And then just quickly, Tanya, before you go, if that's okay, you'll see if you're one of the room kind of leaders or room reporters, there's like a reactions tab at the bottom of your screen on Zoom, and you should be able to raise a hand for that. So if you're one of those reporters, pop a little hand up there and I'll come to you. If not, pop something in the chat or wave your hand on the screen and I'll try to keep an eye out for you. But over to you, Tanya. Tanya, you're just on mute there, if you're able to just unmute yourself.
I'm the reporter, not the leader. It was such a short time. We had such a wealth of expertise in the room. So we didn't have time to discuss it. We probably could spend a whole seminar discussing it. However, what I got back, but I'd love other people to add, is that communication is a key. There were some issues with engagement with all the services to help. And also, I think that each area needs to be dealt with individually because local issues differ. There was a suggestion of taking a mobile unit, but in some areas it certainly wouldn't work. So those were the 3 points. I hope that helps, and I hope that's okay for my room.
Thank you so much, Tanya. I really appreciate that. Fabulous. And then I've seen Ian Wakefield had put a thumb up before. Ian, would you like to come off mute and just report back for your room?
Sure. So I'm representing room 2. So thank you, everybody. So the main things we came up with, probably in order of priority, would be that trust is the key thing. And we felt ideally, organisations wanted to communicate or engage with the communities should do that with a trusted person, and we've just, you've discussed various ways in which you can get a trusted person to come with you. The second key point is to not go in with any preconceived ideas, obviously not to discriminate and not to be condescending, and you might not even realise you're being condescending. And what could help with that is some cultural awareness training, which FT provide. And lastly, to follow through with any commitments that you do make to the communities.
Thank you very much for that, and that's really helpful. Fantastic. I can see that Louise Condon has suggested that perhaps Leanne could feedback for room 6. Leanne, if we're not putting you too much on the spot, if you'd like to, please go for it. If not, perhaps someone else from the group, but Leanne and Louise could feedback.
No, that's fine by me. We took, well, by the time we'd introduced, because obviously because it's such a small space of time and a few members, we spoke about good practice on working and integrating with and finding a way to meet Gypsies and Travellers and Roma within their own communities. And also if there's not a population of permanent sites, how can they engage with those Gypsies and Travellers that are in bricks and mortar? One of the suggestions was that there's an influx of travellers going through a certain area. They can speak to them, and if they know relatives within the area, which often they will if they're travelling through, then they can speak to them. And once you speak to one family and that family's happy that you're there to help and, you know, and not dictate to them how they should live, it often spreads by word of mouth. And then there was one, in Coventry, there's a community hub that people know that they can contact if they need help. And also there's a priest that has dealings with, that meets a lot of the Roma community as well. And also here in Pembrokeshire, I actually run a women's group for Gypsies and Travellers, women. We don't have a vast Roma community here in Pembrokeshire. I think we don't have any at all, to be honest. If we do, it's a very small community that we do have. And we have, that's how I came to meet Louise. She came down, we did the cancer research, and from that we've spoken to a lot of different researchers from different cancer charities regarding screenings and things like that, and like all different charities that we have come, you know, to give speeches, to give talks. And then if a community member doesn't feel happy speaking to that person directly, we'll support them, or sometimes they don't want to speak to us, they want to speak directly to them. So it was mainly good practice on how to locate Gypsies and Travellers in your area and to work with them, really.
Thank you so much, Leanne. That's really helpful. So it is wonderful.
Thank you.
Oh, thank you. If everyone who's not speaking can just pop themselves on mute, that would be really fabulous. Next over, I can see Ian Bowen from the chat has said that he could report back for him. Ian, if you want to have the floor.
Yes, thank you. I was in room 10. We talked about a couple of things, but I'll just mention one or two. Firstly, as people already said, communication, ensuring that people are linked up and can access services. So communication, not only about talking to people, but making sure they have got a contact infrastructure in place. Do they have phones? Do they have smartphones? Do they have access to the internet? Can they read it if they have got access to it? Just kind of knowing the group we're working with. We talked about working through a trusted gatekeeper. Now that might be professional. I work in Bristol, and I, personally speaking, and I am seen to be the person who everyone goes through, but there's 750,000 people live in Bristol, and it all comes down through me. So it'd be nice to develop that a bit better. So perhaps better ways to seek out key contacts within the communities. That's perhaps the best way to get a trusted gatekeeper. But something else that we mentioned right towards the end is what would be useful, and this already may be in place, but I don't know about it, would be some kind of national link up or conversation that we can have between each other. We get because of our location on the M5, M4 corridors, we get a lot of transient communities passing through Bristol. So it'd be really useful to have a network where we can talk to other parts of the country and see what they're doing and what they've already done. So a constant network. That may already exist, I don't know.
That's really helpful. And I think as well that there's a need for that and for more conversations like these, because often there's a really good piece of practice developed in one part of the country that would be really cool to roll out in other places as well, and really positive. That's really helpful, thank you. And then next over to Karen McGuire.
Hi everyone. I hope I managed to cover all the points that we talked about. We felt that we could have better collaboration between local authorities, NHS, voluntary groups, and generally speaking, anyone who is working with GRT communities, and that perhaps we need to have a more pan or stroke national approach to our messaging and comms. There's a lot of organisations, and including NHS and local authorities, and even indeed voluntary groups that are doing some fantastic messaging and campaigning, but perhaps we need to have a more consistent approach. I think that was something that we talked about, and that our messaging is sensitive to each G or T element, that it's not just one-sided, and that equally it's sensitive. And we also talked about where there are gaps for some local authorities, because I know somebody mentioned it in when we were in the general discussion. Some areas in England are very well advanced in their messaging and campaigning, and indeed working with communities. And as Ian said, it's about that networking and sharing of collateral and assets. But perhaps in time, if we can create that wider national group, that our messaging is more on point and that we're all saying the same thing. And that we use perhaps FFT, LGT, Travellers Times as a springboard or a platform for helping us with them with that comms plan in the future, because you already have those wonderful established relationships. So I think, have I covered everybody or everything for room 4? I hope I have, but that's from us, I think, unless anyone says otherwise.
Thank you, Karen. I really appreciate that. That's really helpful. And so is anyone not recorded back yet from a room? You want to pop something in the chat or just come off mute and tell us what your room was speaking about? I can see a thumbs up there from someone, but I can't see who it was. Give me a little wave now. I'm just scrolling through all the different images on my screen. Okay. Denise, over to you.
Do we know if anyone from Group 7 has reported back anything?
I think the room numbers have gotten a little bit mixed up, but I'm very happy, Denise, for you to go for it.
Okay. Yeah, we were just talking about sort of the fact that people shouldn't just sort of put everyone under the same category, that everyone's individuals, and just to accept people for who they are. We also talked about sort of, we actually spent a little bit of time introducing ourselves and didn't probably get as much sort of done as what we should have done with it all. I mean, where I suppose I don't know how many other people have joined this meeting from Wales, but I work for Travelling Ahead, which is based all over Wales, and I'm based right the way down in Pembrokeshire. And we've got we are really lucky in Pembrokeshire because we've actually got great links with the community in any case, where there's brilliant integration, and generally I think people feel that they're as equal, if not you know, I think sometimes there is still sort of segregation, but generally there's a lot of sort of inclusion within our area. We've got a Facebook group that we're using at the moment with over 100 of the Gypsy and Traveller community in the Pembrokeshire way and some within Carmarthenshire, and we're just putting out sort of facts. We're quashing any myths that are being put out there at the moment. We've got a survey that's running to find out how many are actually interested in having the vaccine, and I think we've seen the same as what someone else was saying, that there's suddenly been a little bit more of an uptake on people actually saying they actually want the vaccine. They've seen other family, other friends have it. We keep putting the positive. I know my colleague Leanne, who spoke a moment ago, when she gets her vaccine, will be having a video of her doing it and putting it up on the Facebook group, which we did as well when she had her first COVID test, when she actually had COVID herself, bless her. So yeah, as I said, we also have a lot of the children and a lot of the well, we have probably about 98% of the youth attending mainstream schools, so they're getting the correct information that they can then go home and tell their parents as well.
Thank you very much for that, Denise, and that's really interesting, yeah, to hear about Facebook groups. I know in our local work that's been something that we've really been looking at during COVID, where there are really those trusted relationships and things, and being able to have those conversations. And hats off to Leanne, getting your vaccine done on video. It was a bit of a needle phone, probably I wouldn't be the best person for that, but I'm sure you'll do a much better job than I would. Would anyone else like to come off and just share before we move on to the next section? Okay, I'm just going to move on then, if that sounds okay. That's really interesting, just really fascinating. And again, it's nice to see, yeah, those issues really come up repeatedly, and then also just that feeling that there are some kind of common solutions, that people are doing really positive work in lots of different parts of the country as well. Louise, I think you were going to jump on there and just introduce our next speakers, if that's okay.
Yeah, absolutely, Sarah. I was in room 2 and we had a fascinating discussion, and then reported it back very well. But it became clear that discussion is really important, Sarah, and maybe if we do this again, we need to allocate more time so that people can have their voices heard. It's with my great pleasure, I introduce my colleagues Joe and Julie, who are going to give an update on the COVID-19 vaccine programme. Over to Joe and Julie.
Thanks Anne-Louise, and thanks Sarah for inviting us to this meeting. It's been really, really helpful just to listen, which I think is one of the important messages that is coming out of today, and important for everybody to listen. So I'm just going to give you a very quick update on the COVID vaccination programme. Now, as you probably all are aware, it's being rolled out across the whole country on the basis of age, because age is the biggest risk factor in all of this pandemic. So we've been going down through the age groups, and now if you're over 65, you are entitled to get the vaccine. Or perhaps if you're like me, I'm not over 65 yet, just to make that clear, but I do have some underlying health conditions that put me at additional risk. So I was very fortunate to have my vaccination last week, but that's because I've got these additional risk factors. So at the moment, as I say, if you're over 65, or if you're like me and you've got some serious health problems, then you're entitled to the vaccine. So you don't have to be registered with a GP to get the vaccination, although there are benefits to being registered with a GP. And, you know, we've heard earlier that for some people there are challenges accessing GP services, so that's been heard. But you don't have to be registered with the GP, and you don't have to have an NHS number, but you can access the programme either online, if you're able to use the online service, or you can dial 119. And really, many of us will have seen the effects of this pandemic, either on our immediate families or within our communities, our friends. And, you know, it's really important that if you're entitled to the vaccine, you take advantage of it. So thank you once again. And I think Julie's going to add some more information to that. Thanks a lot.
I think I'm just going to try and get Julie in. Julie's dialed in, so give us a hand while we try this out.
Yeah, she was having some technology problems earlier, I'm aware.
Oh, Julie, are you there?
I'm unmuted now. Yeah, I'm unmuted now. That was interesting. So yes, thank you very much for inviting us. I think that everything that Joe said is clear. We've now vaccinated nearly 16 million people, so we have quite a lot of experience with the vaccine as well, and we know that it's safe, that it's working well, and that many people have had it I work in the southwest, and just to give you an idea of the spread of some of the places that you can access, we've got 179 different sites that we're delivering the vaccine from, so that people don't have to travel far to get the vaccine. And those vary from, you can get it at large vaccination centres, so the ones that you've probably seen on the telly, but also from community pharmacies and GP practices, or groups of GP practices, or sites within the community. So there are different places that people can go to receive the vaccine. You don't need an NHS number, as Joe has said, but you might need to give some information. So like name, date of birth and postcode. You can phone 119 and get book appointments through the national booking system. But most of the areas, I think the information that's already been given about working through trusted people within communities and also listening to our communities is particularly important. So we don't want to make any assumptions about where people want to have their vaccines. So it's really important that there's that local engagement, and that's what's happening in many areas in terms of particularly the local authorities who are aware of where communities are and trusted people within the community working with us. So in the Southwest, we have some examples of colleagues and community members working together to identify what's important to the community and how people want to receive the information from us, so that we're not just providing lots of leaflets that nobody wants, or directing people to services that are not suitable for them. So there are options there, but the most important thing for us is that there's an opportunity for people to engage at local level. Being registered with a GP is helpful from a system point of view, because it enables us to contact people, particularly if there are problems with vaccine supply and so on. But it's not something that has to happen for people to receive the vaccine. So the important messages are that they're free, they are safe. There are some expected things that happen after vaccines, including getting a sore arm and a headache or a bit of a flu-like type of illness. But in the main, those things disappear after 24 hours or so. And like Joe, I'm also having my vaccine next week. I'm not old, over 65. But I also have underlying health conditions. So it's really important that if people have those conditions, they also access the vaccine. So I'm not sure if there's anything else people would like to know about, but I hope that's helpful.
Thank you very much, Joe and Julie. I love the way everybody's justifying that they're not they're not over 65. I've had it too, and I'll leave you to guess. So the next thing we're going to do is another breakout session, and you know the drill by now. You'll get a invite from Lucy quite soon to join a breakout room. Remember what room number you're in, so as you can feed back. And the thing we're going to focus on this time, what are the key steps that local systems and Public Health England can take to promote uptake of the COVID-19 vaccination? And similar to last time, we're asking you to identify someone who will report back to the room, a very brief report of about 1 minute per group. And the top 2 things that come out of your discussion be reported back, please. Thank you. And welcome back, everyone. Again, a very lively and interesting discussion in our group. So rather than go through them in numerical order, I'm gonna try and ask for volunteers. And is there anyone who would like to speak first?
I'll go for our group.
Thank you.
As I agreed, so I'll get it out the way.
On you go.
So we just spoke about how important it is to send out clear messages to the community, and how people can switch off if they're confused. And we obviously said that is across the board within society. If you're getting lots of different information and you're confused, you tend to just stop listening full stop. And I think that's been quite present across, within this pandemic. From what I have heard, we're all getting confused. People are getting confused with what information to believe, and people are just tending to switch off, which seems to be sometimes easier than listening. And we spoke about how NGOs have some sort of upper hand to passing messages on to the community, obviously because they've already got a good insight into the background of the community and what they want, and also usually already have a built trusted relationship with the community. We also spoke about how community workers have also got a good insight into what community members want, and also probably have a little bit of upper hand there because they've got that trust, and they know what the community members might be finding an issue to understanding or listening, and what information or what way to speak to members, community members, will work. And we said, approaches need to be varied. People need to have different ways of receiving information, and not just one way. Like we said, in a class of 30 children, you're going to use different approaches for each child to be able to understand. So it's not just looking at the community as one. Obviously there is individuals within that, and people are going to have to be delivered information in different ways to be able to understand. And we also said it's about not just giving information and trying to lead people to making a decision. It's about giving people clear information to make them understand and trust what they're understanding, to be able to empower them to make a decision what's right for them. And I think that's something that was very present within our vaccine strategy at Leeds Gate. We always keep saying it's not about trying to be leading our members, it's about empowering them to make the right decision, and always aware of whatever messages we're sending out, making sure that they're not leading, and making sure that they are just giving some clear information to members for them to be able to make the right decision. And I think that sums up some of what we spoke about. If anybody else wants to add anything.
Thank you. Thanks very much. I shall move on then to, I see from Ian Bowen that he's happy to speak for his group. Ian, do you want to unmute?
Yes, thank you. I'm speaking for Group 10. We were saying that we need to get a lot more information out there, which means getting information out in a wider range of languages, including pictorial versions for people who don't have great literacy skills. Oh, I've lost my place already. I need to have something going out which is easy to understand and which is enabling, which people want to pick up on. We also talk about using WhatsApp and texting and other social medias as ways of getting to people. And I don't know if Susie is still here, but Susie McShane, who is from DCMS, was saying that they're currently developing a short animation designed specifically for use on WhatsApp. So really easy, I don't know if Susie's still here and wants to comment on that. So a really easy way to pick up on.
Yeah, thanks, Ian. So this is in around the mis and disinformation about the vaccine, but it's a very sort of complementary message to vaccine uptake because it is one of the barriers. And we've developed, it should be ready in the next couple of weeks, but just a short 15-second animation, and it sort of simulates a WhatsApp group discussion. You know, someone in a family sharing a video about the vaccine, you know, a sort of negative falsehood about the vaccine, and then a younger person sort of pointing out that that doesn't look like, I think we've called them Dr. Natural Health, looks a bit dodgy, and you might want, you know, the NHS is the best place to find out information about the vaccine. And then at the moment, the key message is sort of check before you share. So really simple. And we're just putting that into testing at the moment, but that's the concept. And the idea is it's really shareable. People can share it within WhatsApp, which is where a lot of that sort of sharing is already happening. And it can also be used on social media channels. And I think just using that, working within that means we can be a lot more conversational than we would normally, because it's just in kind of WhatsApp chat language, which hopefully people will identify with.
Susie. And Ian, had you finished? Can I move on?
Yeah, pretty much. The only thing is, again, come back to what we already said about creating a national, perhaps using this as a starting point to create a national network.
Thank you very much. And Lisa Gavin.
Hi, I'm feeding back from Group 7. So lots of really interesting stuff, particularly from the Baines people, which is absolutely fantastic, the work they're doing now. Real leaders for some good work with the local CCGs. Engaging with the public health team locally down there, particularly around the liveaboard boaters. Happy to share their how-to guide with a set of slides, which hopefully we'll all get access to after this. But it looks as though they've been targeting not just, well, what they've been doing is avoiding targeting, actually. And so you're starting with a position of increasing flu uptake, and that being seen as a sort of an opener for wider health checks, which has been not just sort of hammering people with you need to get vaccinated and this is what we're targeted, so that people don't feel discriminated and targeted. But they've done some wonderful work there, using trust and their trusted people in their outreach teams, as well as huge support from their local CCG. So they've been accessing funds from, you know, the winter fuel payments, that sort of thing, to get grants for, in an innovative way, with things like gas bottles and things, so instead of the prepayment meters that are usually used for those sorts of things. But and sort of involving a multi-agency approach by, for example, using St John's Ambulance to be commissioned to produce winter first aid kits, and having discussions not just about flu, but about the vaccines, about people's general health, that sort of thing. So much more valuable to the clients than feeling that they're just being targeted to increase the rate of, you know, the uptake of vaccinations. So really great work there. And also looking at other things like food poverty, fuel poverty, those things, and how that all impacts on the public health. They've had great buy-in, not just from the CCG, but from the public health team, having a GP on site, some, you know, really, really good models of what we can also do in other places. I think there was some other discussion about using the local connections, using the systems and trusted professionals, including trusted members of the community where there's trust, where the community trusts the professionals, building on those good relationships to actually use what's already working. Again, there's been a lot of discussion about a variety of approaches and different things, not having preconceptions, meeting people where they are, and not just coming in with a particular agenda as outsiders and professionals. I think that's absolutely fundamental.
Thank you, Lisa.
Yeah,
sorry, we're going to have to move on.
A lot of talk about comms as well.
Thank you. Sarah, I see we're running short on time. Do you think we need to draw a line under this? If if you could maybe just feedback through either the chat or directly to Sarah or I on any of the other discussion points that come up in your discussions, then we will get them in that way. We've learned a lesson, Sarah. We need to factor in more time for feedback. Thank you very much, everyone, for these really helpful discussions. I think we've got one of my colleagues, Kirsten, who's from Public Health England. She's the publications manager, so she's going to talk about some of the resources available for the COVID-19 programme. Thank you, Kirsten.
Hi there, just bear with me. I'm having a slight technological lag, but it should be with you in just a second. So thank you very much for allowing me to be part of this today. I've learned so much from the previous presentations. It's been incredibly insightful to understand a lot more. And I almost wish this was a day workshop where we could have really good conversations, because it was very clear that people were able to contribute really important things, but we just didn't have enough time to cover it off as comprehensively as we would like. And I'm just struggling with the fact that the Zoom toolbar is just getting in my way a little bit, so just bear with me at the moment. So we've been working incredibly hard since the vaccine rollout, and there's a lot of very exciting things been happening, and many people have been having their vaccines. And at the same time, we're very conscious of the fact that when you're in a pandemic and you're creating information quickly and at pace, and that there aren't these lovely FAQs back in September, and we've had a sort of information void, if you like. Sorry, my screen's completely frozen now, so I'm just going to do it off the cuff. And it's clear that in that void, we've got a lot of mis and disinformation, which is why we've worked very carefully to produce as many accessible resources as we can. So at the moment, all of our core leaflets, and that the core leaflets you should be offered if you're eligible, is a leaflet for adults. And then if you decide to have your vaccine, you should have a record card and a what to expect leaflet to explain about the common side effects, etc. And women of a childbearing age should also be given another leaflet, which talks about pregnancy, etc. And we know for the GRT group, and we know from attending previous meetings, that actually any amount of written leaflets is not particularly helpful for this group. And actually that's why we've worked to produce a set of 52 explainer videos that are short form videos in English. And we've also worked to translate those leaflets where it's possible for people to read in their own language into 19 languages, including Romanian. And we are now working to produce short form audio versions of that, a bit like a radio ad, and that they will be readily available to share on social media, because we know that those platforms are really where a lot of people are chatting and raising their concerns and having conversations about the vaccines, and that they are vulnerable to a lot of quite powerful mis and disinformation. And with any vaccination program, we like to pre-bunk rather than debunk. So that is to give people the information about the vaccine, about the disease, about how the vaccine works to prevent that disease. And this vaccine, we know if people have it, gives good protection, the best protection that we have against this terrible disease. And we know that 2 doses is very important to get that best protection. But what was not so clear about coronavirus is whether these vaccines can stop transmission, so they can stop you passing it on to other people. So unusually, we are advising that even if you have this vaccine and you have your 2 doses and you are protected, that you still have to socially distance, you still have to wear a mask, and you still have to wash your hands. So we've produced important easy read versions, and these are very helpful where people have low literacy. They rely on a picture form, and if my screen wasn't frozen right now and I wasn't having IT difficulties, I could show you that. They're very well laid out nicely and clearly, so that you can follow the story of what to expect at your vaccination. You can follow the story of how to think about whether you should have the vaccine if you're a pregnant woman. There are no concerns with this vaccine in pregnancy, so you can have your vaccine and not worry about fertility, etc. But if you are pregnant, and if you are at risk and you have any other health conditions, or if you are somebody who works in the front line in health or social care and is therefore at risk of high risk of COVID, then we do want you to think about having the vaccination and the protection it covers. And we're very aware that with this this program, because we've got new vaccines being added, And each time we do that, we revise our publications and we do a new version, and that can be very confusing for health professionals. And we covered that off in our meeting a bit, that, you know, if the health professionals are a little bit confused sometimes, it's no wonder the public is struggling to keep a clear idea of the facts. And that's why we really want to promote trusted sources. Trusted sources are places like your GP, if you have one, practice nurses, the NHS website, the Public Health England website, our health publications website. They're all places where you can get good, safe advice. And you can also order copies of these easy read leaflets if you need them to promote them. And it's really important that the contents of those leaflets are the facts that people use to share about the vaccine, because we're very careful in our leaflets to put in information about the safety and the and where you get your vaccine and what to do afterwards, and what to do about common side effects, etc. But what we do need to do is adapt that content into the format that these GRT communities can actually actively use and actively share. So I've put the link into the chat to the videos, and there are sort of first efforts, if you like. There are phase 1, and we're now moving to do our phase 2. So as I said, we've got a lot of written material that we know is not particularly suitable for this audience, and now we're working on audio versions to support that, and we'll be making those available not just on the government websites and not just through our networks, and we'll share them with you as well, but also significantly on the national telephone line, so that when people phone up that line, they can actually listen to an audio version of the leaflet. And I think that's going to be helpful for some communities. But we also need to sort of do a bit of testing with some of these earlier versions. And I know Karen and Emma and various other members of group, I think it was 4 and then 7, might not be quite getting that right, but certainly offered to sort of look at some of our resources and to evaluate them and share them and see how well they land. And that's why I asked earlier in the chat if I could see some good examples of health messaging that you know have worked well and landed well, just so that we can get a little bit more learning about what sort of messages work well for these communities, and we can share that learning and then make sure that what we're producing really is meeting those needs and giving the community champions, the advocates, the health professionals, the people reaching out and the people being reached out to have the same clear, trusted information. I think I better stop talking now. I'm sorry that my presentation wasn't very visual for you. I do humbly apologise, but IT has not been my friend today.
That is so helpful. Thank you so much. That's really brilliant. And I'm sure if you want to share the slides, we can share that with the group.
Yeah,
well.
absolutely. I'll send them to you straight away, Sarah. So sorry, everybody.
Not at all. Thank you so much for that. Really, we're coming to the end of the session now. I think that was really helpful. I think, yeah, just to agree with Louise, we needed more time, didn't we, to discuss everything? So maybe we'll have a bit of a conversation afterwards as to whether there's a need for a kind of future forum like this where there's more room for discussion. Just in terms of next steps from FFT's perspective, at this point. So we really know that many people are busy on the ground getting on with this work, and we have some big deadlines. This is quite an urgent thing, especially around the COVID-19 vaccine. So thank you so much for taking the time to participate. And what I know is will be very busy calendars for everyone on the call. We'll have a bit of a think when we go away about how we can carry forward those future conversations and how we can link in with each other. For those people on the call here from Gypsy, Roma, Traveller or Border communities and are joining this call not as part of an organisation but an individual capacity and with their own time, we'd really like to thank you with vouchers just as a bit of a thank you for your time. So please pop Billy or myself a message. You should have got a link, should have got the link to begin with through Billy or whoever connected you to the call. Definitely let us know and we'll be in touch about that. A number of people in the chat have asked about whether a recording will be available, and the plan is yes, that there will be a recording available. And I can see there's been so much useful information shared in the chat. So we'll look through that after the meeting. Any of the links being posted there, we'll try to bring that together into a bit of a document so we don't lose any of that. If you wake up during the night and think, gosh, I should have shared this thing or whatever else, feel free to pop it through to myself or Billy and we'll keep an eye on that the next couple of days and we'll send a bit of a roundup. Presentations the same, where speakers are happy to share information, we'll definitely share that on with you. We'd love to hear about how you're getting on, if you overcome some of the barriers after this workshop that you were experiencing, whether you are experiencing new barriers that you weren't expecting. After this, please just give us a shout. We're also planning to send out a feedback form, so please do feedback what you found useful and not so useful, and we'll definitely keep that into your account for future events. There were some conversations around people talking about a national network. It isn't explicitly for health, but there is a new organisation called Moving for Change, and they bring together professionals from voluntary sector organisations, local authorities, universities, individuals, who all have a kind of shared common purpose about improving the lives of people living roadside. So if you are interested in that, I'll share the link for that too. So it's movingforchange.org.uk. You might find that really helpful if you're specifically looking at the issues being experienced by nomadic communities. Just to share, just really briefly, IFFT are running a GP registration drive at the moment. So we've got a special helpline from now till the end of May rather. So if you are working with clients, you're struggling to get registered or don't have up-to-date contact details, or digital's not working and digital appointments seem the only thing available, give us a shout. And then just really quickly then, yeah, feel free to visit our website. I'll hand over to Louise, and just to say thank you so much for taking part today.
Thank you, Sarah. Not like me to have the last word. It's been a fantastic workshop. It's been a real privilege and an honour to have been here this afternoon. We'll take all the feedback when it all arrives in and process the information that we've learned today. And we can discuss next steps, Sarah, about what we want to do something similar in the future. But I will take the information back that hearing very clearly in the second discussion session that the information about registration and NHS number not being required for vaccination hasn't filtered through the ground yet. So we'll definitely take that back to national level. And thank you very much, everyone, for attending.